history of MaXimus system began in 2005, when Gambler Medical Company started actively using Diakea software produced by Gambler Company in Russian dialysis centers, which it supplied. The use of Diakea software for analysis of data automatically collected in clinics allowed to improve the quality of dialysis procedure on company's artificial kidneys. However, over time, restrictions and disadvantages of this software product were identified. In order to achieve a qualitatively new level of treatment for patients with chronic kidney disease, reduce the number and severity of complications, it is necessary to create a more suitable tool. It was a logical step for Gambler Medical Company to create an intelligent, automated system of treatment optimization MaXimus. Principles incorporated into this project has shown during few years of test use the correctness of system general development course. Those principles also confirmed an urgent need for such a tool by clinicians and identified weaknesses of the system and the ways of its further development. There is an urgent need for a more scientific, systemic approach to the organization of design and development of MaXimus. Such approach also allowed to take into account all the features of the nephrology department in the new conditions of Russian healthcare development and implement a system in accordance to modern international standards. Nephrology Expert Committee was created for outpatient and clinical practice in the region and the implementation of common policy of nephrology care for the country population, including hemodialysis. The work of this committee is based on MaXimus as a management system for all objects of nephrology service. The transition to a higher level of modern science during the development of the system was made possible by involving a team of specialists from the fields of systemic analysis, business processing, and process design of automated systems, form the backbone of the Diakea Soft company. The development of the system project, which described the methodology of the process of creation, elements, goals, criteria, structure, and functions of the system and their relationships, was based on systemic analysis of the problem and audit of previous version of MaXimus. This film describes some features of the new version of MaXimus, both already realized and prospective. The mission of the system is the maximum improvement of the patient's condition. Our main goal, improvement of the quality of the diagnosis and treatment process, corresponds to this mission. Thus, the MaXimus system is a diagnostic and treatment process control system in the Department of Nephrology and Dialysis. General principles implemented into the system allow the user to customize the system for use in other areas of medicine. The basis of MaXimus is PLM system methodology, product life management. Products in MaXimus are patient, his condition, a diagnostic and treatment process, the action, the staff, his action skills, the state of the equipment and other objects of the life cycle management. MaXimus is patient life management, process life management, personal life management, equipment life management. We described application domain, formulated the problem, developed a hierarchical tree structure of three of system goals, worked out cause and effect links as the original diagram, constructed conceptual mathematical model of the system, formalized and described in detail business processes as is in existing offices and as should be in the prospective centers of nephrology and dialysis, equipped with the system, developed criteria for assessing the quality of activities for all levels of management. All these tasks were based on analysis of work of centers of nephrology and dialysis. Finally, MaXimus acquired all the required properties and started being implemented as a complex, multi-dimensional, multi-criteria system. As a part of the project, we developed and incorporated into MaXimus all necessary regulations for the diagnostic and treatment process. The basis of creation of these regulations were the strategic maps, designed for all levels of management and based on modern methodology of balanced scorecard. Cards linked all the objectives, criteria, and business processes. In the regulations, we unified and described the business processes in the form of easy-to-read, standard PPMN charts with decomposition to the level of operations and their descriptions. This graphical representation of the processes of diagnosis and treatment allows us to see those processes by roles, conditions, activities, sources of information reflecting the organizational structure and job descriptions of staff. System also regulates an assessment of all activities as a set of interrelated criteria for evaluating the quality of patient treatment, work of staff, departments, centers, and Nephrology Advisory Council as a whole. The regulation is based on standardized business process chains. Practically, business process diagram is a map of routes with points of conditional branches depending on boundary conditions set and criteria for optimizing the treatment process. Thus, in MaXimus, the structure of goals is implemented as an interconnected set of criteria for achieving those goals. Criteria determine the conditions, the directions to those goals, and constraints in achieving them. At the same time, there could be criteria, so the decision in MaXimus in general is a multi-criteria in the multidimensional disturbance space and control parameter space. As noted earlier, the main aim of MaXimus is to improve the quality of treatment. All the internal mechanisms of the system managing the process of treatment are subordinate to this goal. This is primarily doctor decision-making support mechanisms providing a definite diagnosis and production of adequate treatment program. Rapid diagnosis in MaXimus implemented a so-called diagnostic machine that helps to make diagnosis with the emphasis of domain nosology, concomitant nosologies and complications, to assess the accuracy of diagnosis, the severity of the patient, as well as make recommendations for additional studies that are needed to improve the reliability of diagnosis. The system allows not only make a diagnosis, but also help to predict the course of disease. To do this, the system uses another component, the ICD-10, structured in the form of cause and effect relationship between syndromes, entities that are also classified according to functional systems of the human organs. In doctor's decision support system, this service is formed as a uniform associated graphical forecast model. By analyzing the relationships in this model, we can find both the root cause that lead to the currently established diagnosis and prognosis of development of patient disease with a certain probability and to form and adjust the appropriate treatment program. Diagnostic machine and predictive graphical model are made in the form of individual services of the system. They can be used in both primary and differential diagnosis and for reference, educational and other purposes. A logical extension of the diagnostic machine and forecast graphical model is a module of system for the automated generation and optimization of patient treatment program by given criteria. Model functions include forming business process chains for the treatment program, as well as the search for the optimal parameter values of each transaction in the chain of business processes. Thus, the optimization of the treatment program is a choice of optimal control parameters for each action of the route of the business process of treating a patient. Or in other words, the optimal trajectory parameters in the multidimensional space of business processes. Electronic medical history is a basis of the accounting subsystem of MaXimus, the informational basis of all the diagnostic treatment processes in the healthcare setting. It dynamically gathers and records all patient information in the online mode, both from the connected measuring equipment and a doctor from any fixed or mobile access point. MaXimus driver is another very important and useful software component of the system that allows reading information about ongoing processes from different instrumentation, sensors, scanners, readers of different manufacturers connected to the MaXimus automatically, in real-time mode. MaXimus driver not only reads the information, but also transmits the prescription data to devices, signals of emergency situations, etc., that it work with both direct and reverse link in the control and management loops of MaXimus. The functionality of electronic health record and decision support subsystem in MaXimus are based on the structured medical knowledge base, formed and system built in the form of frame network describing nosological forms, clinical protocols, and different classifiers in the relationship of the feature space of the patient. Sources of the information for this knowledge base are leading experts and scientists from Russia and the international open internet resources such as NICE, UpToDate, etc. All information in the knowledge base is formalized and coherent. The knowledge base is also contain case component, which formed by collecting and processing of statistical data of objects connected to MaXimus and is used both in diagnosis and for development of treatment programs. Knowledge base is periodically updated on the basis of case component and pattern search algorithm, which is the basis for self-study system. MaXimus provides not only the development of adequate treatment program for the patient, but also its optimization in accordance to various criteria. In this sense, one can imagine MaXimus as a system which formed a kind of portraits of patients, consisting of the values of parameters of the patient in a formalized, multidimensional feature space of systems and corresponding treatment program. Then the problem of optimization of the treatment is a change in the patient's portraits according to the target system structure, according to the certain criteria. Besides the function of automated collection of the patient information in the electronic health record, diagnostic machine, graphical forecast model and the knowledge base, the doctor is provided with tools for independent analytical work with data. Opportunities of tabular and graphical representation of the parameters of the patient and of the process in the several cuts at different levels of detail greatly facilitate analysis of the factors of influence. This allows the doctor to cover the whole huge amount of diverse information to develop the right decisions for the treatment of patient. MaXimus system is based on service-oriented architecture. This extends the range of the users, the scale of application, increases the flexibility of configuring the system for the healthcare setting. This architecture allows the transition from purchasing a license to subscription on use of selected modules from the web service registry. This dramatically lowers the total cost of ownership of required configurations. In turn, for users, the use of service-oriented architecture is manifested in the possibility of use of different customizable mobile interfaces for different operating conditions, roles, and goals. The system implements logging functions of personal actions through the use of personal plastic cards. All personal actions with the patient or equipment are logged by the system, which allows to estimate the amount and quality of the staff work in accordance with the regulations in NEC medical diagnostic centers. The system enables the possibility of rapid calculation and reasoning of cost and reimbursement for the patient's treatment program for different diagnoses. In other words, MaXimus is a tool of evidentiary medicine. Telecommunication possibilities inherent in the system erase the physical boundaries between clinics, creating a single informational space of the virtual hospital. So the doctor in a remote clinic can receive expert consultations from physicians' community regardless of their location. Physical environment where the MaXimus system operates are the existing centers being built by Nephrology Expert Committee, based on dialysis clinics and offices located in the regions of Russia. In the conditions of lack of qualified personnel in the remote centers, the problem of skilled care for the population of these areas are resolved not least by means of telecommunication organizational capabilities of the system. Optimal use of existing human resources, timely qualified patient care in the field, expert advice, training, opportunities for joint research, information-rich reference base, all of this is possible on the basis of an extensive network of MaXimus. MaXimus has great opportunities to identify patterns of interaction of parameters of the patient, clinical processes, equipment and staff, allow to create new formal scientific and practical knowledge for both the Russian and international nephrology and medicine areas in general.